Don't look now, but the flu season is coming. That's always on an infection prevention's radar. In the 2019-2020 flu season, between 24,000 and 62,000 people died of the flu. The range is so wide because it is difficult to determine the exact cause of death in many cases. Hi, I'm Frank Diamond, Managing Editor of Infection Control Today, where we want to give infection preventionists the information they need to keep patients and other healthcare workers safe. Joining me is Linda Spaulding, an infection prevention consultant and a member of Infection Control Today's editorial advisory board. Linda also writes for us. She's a wonderful writer. And for an upcoming issue, Linda is going to be writing about the difficulties involved in dealing with the flu on top of COVID-19. Linda, thanks for being with us today.
Glad to be here, Frank.
So how complicated can this get, dealing with the flu and COVID-19?
This can get very complicated, and I don't think it's a matter of will it be complicated or not. I really think it's going to be. Currently, we're still dealing with a large number of COVID cases throughout the United States as well as throughout the world, but we don't have enough testing for COVID in place yet to be able to give us the things we need during flu season, because we're going to be having to do flu swabs as well as COVID swabs, because both COVID and the flu have similar symptoms. So in the past, we only had to worry about flu. Okay, you started getting a lot of people with a respiratory tract infection and fevers. You knew you probably had a flu outbreak going on. Now, you don't know if it's going to be flu or COVID. And unfortunately, there's going to be no way to distinguish between the two unless we have really good testing and being able to test a lot. And right now, we don't have that capability in the United States. We'll be able to test for flu, no problem. But the COVID test, we're still going to have problems. So in the past, the flu swab will come out negative, and then we would send it on for PCR testing. And then that would confirm, do we have a flu outbreak going on or not? So now we're going to have to do the rapid flu. If it's negative, we're going to have to send it for PCR. But the labs are going to be inundated, because not only will they get flu swabs for PCR, they're also going to get COVID swabs for PCR. And they're having a hard time keeping up with COVID now unless labs are able to increase their manpower. They're going to have double, triple the lab work. And so that's going to mean a decrease in time getting results back for probably even influenza PCRs.
So you're saying it's going to get crazy, but what can an infection preventionist do except brace and do the best they can among the craziness, right?
Well, there's a lot they can still do. We've been dealing with COVID enough so they know that they have to isolate, they have to wear PPE. For flu, we would be suggesting the same PPE as we do for COVID, but you're not going to have a flu ward, a COVID ward, say like in long-term care, because you're not going to know if it's COVID or flu. And unfortunately, I think long-term care is going to get hit pretty hard, because a lot of the resources will still go to acute care, because their numbers of hospitalizations are going to possibly double also. So good hand washing, proper use of PPE, keeping residents in their rooms, doing OTPT in the rooms, restricting visitors. Visitors just are not going to be able to come in, because they can bring the flu in, they can bring COVID in. So some places have opened up that you can go outside and sit with your loved one and visit. But I think when flu season comes on and the flu outbreaks start, that's going to come to a halt again also. Flu vaccine is extremely important. And don't forget, you know, when the flu is here, we also have a lot of other respiratory viruses during that time. So it's not just influenza A and influenza B we see during flu season. There's more flu circulating. we're only testing for the flu that they suspect is going to cause the most deaths for that year. That's how they decide what the flu vaccine is going to be. So there's still RSV among young kids and even the elderly. A couple of years ago, I worked up an RSV outbreak in a long-term care facility of all adults. So we still have the common cold. We have rhinoviruses. We have all kinds of things circulating during that time, along with flu and COVID. So it's going to be very, very busy few months.
So 2 people come into the hospital, into the acute care center, both with respiratory disease. How long will it take, and one has COVID and one has the flu, how long will it take healthcare workers and infection preventionists to know which one is which?
If the hospital has a good rapid test, and there's a lot of rapid tests on the market, but not all of them are accurate. If the hospital is lucky enough to have one of the accurate tests, then you could probably get results back in, I'd say 15 minutes, half hour. For influenza, you should be able to get influenza results back in 15 minutes to half hour. But remember, that's only a rapid test. For influenza, 80% of the rapid tests, no, 20% of the rapid tests might be false negatives. Right. So you still have to go to PCR. PCR tests usually run up to 48 hours to 7 days, depending on the lab capability in whatever particular part of the country you're working. So it's still going to take some time. And my concern is if the rapid for flu comes back as positive, can we be assured that that person doesn't have COVID also?
Can we?
That's a big, we don't know. We haven't had a flu season with COVID yet. So we're going to have to see how it all plays out and how many co-infections do we have of COVID and influenza. Or we just treat everybody as if they have the flu and COVID, PPE up for everybody that has a respiratory tract infection. Now in kids, it's a little different because here in Miami, where I am right now, kids are presenting with diarrhea, not fever. And so you go looking for the GI bugs in kids, but in this particular area, we know if a child comes in to an ER with diarrhea that we have to think COVID because they may not have a fever. That might be the only sign they have. So that kind of causes a problem in the mix too.
Is there anything systemically that an infection preventionist can maybe talk to hospital administrators about or leadership teams about that they can try to put in place to handle this situation?
Nothing more than PPE and hand washing and flu vaccine. That's the only arsenal we have.
What about drive-through testing?
Drive-through testing has been done for COVID. It could be done for flu, but even a lot of the drive-through places have closed down because of lack of testing supplies. So like I say, we've never been here before. So when flu starts hitting really hard, we're going to start seeing, okay, how are we going to adjust for this depending on the situation? Because the problem we might have in Florida may not be the problem you have in Ohio. They might have a whole totally different problem. So whatever we're doing isn't going to work for them and vice versa. So CDC will monitor it closely, and then they will help us adjust what we have to do in different areas of the United States.
When does flu season typically come along? November, is that correct?
Well, they look at usually October through May, but a lot of states have seen outbreaks of influenza in September. Yeah. So we're looking at just a few days away before we might be seeing some flu activity.
Any final words of advice for people on the ground besides just do what they usually do as infection preventionists and wash your hands?
Contact tracing, good hand washing, get the flu vaccine. I'd like to say get plenty of rest, but if you're a nurse these days, you're already exhausted, so plenty of rest isn't going to help you. And that's really about it. You know, monitor what's going on. Employees of the hospitals and long-term care facilities need to be looking towards infection control to give them the information they need, because infection control is usually monitoring the situation very closely. They can recommend when we see by surveillance every morning, we're getting into trouble, we're starting to see more flu, we're starting to see different symptoms, we have an uptake of RSV, you know, all those things. So infection control people really have to monitor closely all respiratory viruses that are out there, and be sure that you're working actively with management to help put in place whatever needs to be put in place. And, you know, communicate well with the nursing staff. Communicate well with all departments, because if housekeeping sees nurses wearing a particular PPE, but they're not being given it to wear, they're going to be scared. Why do they get better protection than me? So you got to have all that communication, line of communication open, and really work hard at it.
What about the lines of communication to public health officials? Is that something above an infection preventionist pay grade? Is that something that the hospital administrator would do, or what?
No, infection control or infection prevention talks to the Department of Health frequently, sometimes on a daily basis. And our Department of Health will let us know, hey, there's an uptake in the cultures that we're getting, because they will get a download from all the hospitals, and they will be able to watch when there's an increase in influenza or an increase in respiratory disease, an increase in diarrheal disease, that kind of stuff. So we get that information from the Department of Health, because they have data put in from all the hospitals that come to them on a daily basis, and they can analyze that data and then give us heads up, hey, this week we're seeing an increase in this particular thing. So the communication is usually very good between IPs and Department of Health.
Ms. Spaulding, as always, a fascinating conversation. Thanks for visiting us here at Infection Control today.
Okay, happy to do so. Take care and stay safe.
You too.